Briana Cohen, and my final project was based on Canada. For Canada's origins, Canada is North America's second largest country. It consists of 10 provinces and 3 territories. It borders the United States and over the longest international land boundary. Over 40 million people, twice the population of New York City, live here. Indigenous people have inhabited the lands for millennia. It emerges as a federal domination in 1867, marking its independence from the United Kingdom. The Statutes of Westminster and Canada's Act of 1982 solidifies Canada's independence. And this is also a flag of Canada. For demographics, Canada's population is 39 million, accounting for 0.48% of the global population. Mortality rate is 7.8 deaths per 1,000 people annually, mainly due to heart disease, cancer, stroke, respiratory diseases, and accidents. Healthcare systems addresses chronic conditions, mental health disorders, and infectious diseases. Challenges include addressing chronic disease burden and enhancing mental health access. Proactive measures include preventative care, early diagnoses, and effective chronic condition management. This is going in a little bit more depth about Canada's mortality and morbidity rates. Mortality rates, the number of deaths in a population over a specific period, often expressed per 1,000 or 100,000 individuals. Morbidity rates, the incidence or prevalence of disease or illness in a population. Canada's most common causes of deaths and most treated illnesses. For Canada's most common causes of deaths include heart disease, cancer, respiratory diseases, injuries, and other chronic diseases such as diabetes, liver disease, and kidney disease, which also contribute to the mortality rate. Most treated illnesses is hypertension, diabetes, both type 1 and type 2 are common chronic conditions requiring ongoing management and treatment. Mental health disorders such as depression, anxiety disorders, and substance abuse disorders are prevalent and often treated through counseling, medication, or a combination of both, such as arthritis, as well as respiratory conditions such as asthma or COPD. Canada's Medicare, a publicly funded healthcare system, provides government coverage for hospitals and physician services, with some private providers also present. Canada's Health Act mandates provincial and territorial healthcare insurance plans to meet standards such as public administration, comprehensiveness, universality, portability, and accessibility. Canada's Medicare is accessible to certain population groups such as First Nation residents, Canadian Force members, eligible veterans, federal penitentiary inmates, and refugees, all free of cost. As far as United States healthcare system, the US healthcare system is primarily private, with private insurance companies, pharmaceutical companies. Government programs like Medicare and Medicaid provide coverage for certain populations. The Affordable Care Act, also known as the ACA, also known as Obamacare, is a significant regulatory overhaul and expansion of coverage in the US healthcare system since Medicare and Medicaid in 1965. It came into effect in 2014, which holds the uninsured share of the population, and enacting delivery system reform to constrain costs and improve quality. The ACA also provides medical coverage to individuals with pre-existing conditions, which is the whole point of the ACA being passed as a bill. However, if individuals do not qualify for Medicare, then they are subject to pay for private insurance and higher out-of-pocket costs for medical procedures and medications, and also can go through their employers to receive free benefits for full-time. How does Canada receive funding for medical insurance? Canada's healthcare system is primarily funded by federal and provincial taxes, which are then directed towards provincial governments for the provisions of services to its citizens. Access to healthcare in Canada is based on medical need, with funding provided through the Canada's health transfer and other fiscal transfers. The 13 provinces and territories administer healthcare, each with its own healthcare insurance plan, and receives per capita funding from the federal government. How does the United States receive funding for medical insurance? Employer contributions, such as both employers and employees contribute to the insurance premium. Employers often cover a significant portion of the expense. Government programs such as Medicare and Medicaid, and also children's health care insurance plans like CHIP, jointly funded program for children and families with higher incomes. Individual premiums such as private insurances, subsidized and tax credits. The Affordable Care Act provides subsidized and tax credits to make insurance more affordable for lower income individuals, such as Keystone First is a prime example. Government grants and funding. Various federal and state programs receive government funding to support specific health insurance initiatives. Out-of-pocket payments, some healthcare services may be paid for directly by individuals throughout out-of-pocket payments. Canada's healthcare system overview. Who qualifies for public healthcare options? Medicare, private healthcare options, complements the public system, funded primarily through taxation. Eligibility for public healthcare extends to all Canadian citizens and permanent residents. Temporary residents and visitors may require private health insurances or pay out of pocket. Primary method of delivery, delivered through hospitals, primary care physicians, clinics, and specialized providers. Primary care, initial point of contact for non-emergency needs. Hospitals offer acute care, specialized treatments, and emergency services. Clinics and specialized facilities cater to specific healthcare needs. For the United States healthcare overview, who qualifies for public healthcare options? Medicare, federal program providing healthcare insurance for people aged 65 and older, some with disabilities and some with end-of-stage renal disease. Coverage includes hospital insurance, medical insurance, and prescription drug coverage. Medical coverage typically include hospital insurance, Part A all the way to Part D. It is administered by the Centers for Medicare and Medicaid Services, CMS. Primary methods of delivery is hospitals, primary care physicians, clinics, specialty care providers, prescription drugs, home health services. The Canada's Health Act of 1984 prioritized public administration, comprehensiveness, universality, portability, and accessibility. Addresses challenges like long wait times for specialized care, invest in healthcare infrastructure, workforce development, and digital health technologies like telehealth. For the proposal, what the US could adopt from Canada to improve their own healthcare system is bulk negotiations of prescription drug prices in Canada. Government negotiates drug prices on behalf of the entire population. This strategy results in substantial discounts on prescription medications, reducing costs for consumers in the healthcare system. Implementing this strategy in the US could lead to significant cost savings. This approach could alleviate the burden of high drug prices on patients and reduce overall healthcare expenditures. Also, having a single payer healthcare system in Canada and the US. Canada's single payer system ensures universal access to medical services. Adopting a similar model could streamline administrative costs and reduce complexity of dealing with multiple providers. This could result in cost savings by eliminating overhead associated with billing, marketing, and profit margins. As far as a couple of interesting facts about Canada, Canada is a bilingual nation. Their official language is English and French. Multicultural society with over 200 ethnic origins. World's leading producer of maple syrup, celebrated annually. They're also very known for syrup, but it's only Canadian syrup. As far as the syrup, here's just a little background about that. Canada is the world's largest producer of maple syrup, primarily centered in Quebec. Maple syrup is derived from the sap of maple trees, primarily sugar maple and red maple. The sap is collected during the sugaring season, which is when temperatures fluctuate above freezing. The sap is boiled down in large evaporators to remove excess water and concentrate the sugars. Maple syrup is classified into different grades based on its color and flavor profile, with each grade offering distinct characteristics and culinary uses. Maple syrup holds significant cultural importance in Canada, associated with traditions like maple syrup festivals, pancake breakfasts, and maple taffy making. The maple syrup industry contributes significantly to Canada's economy, generating billions of dollars in revenue annually and supporting thousands of jobs. And this is just a picture of the different types of maple syrup in Canada. Also, polar bear capital of the world, Churchill, Manitoba. They're known for having a lot of polar bears there, a lot of sightings. It's located on the western shore of Hudson Bay. Churchill is a significant site for the annual polar bear migration. The area serves as a staging ground for polar bears as they prepare for the sea ice freeze up. Churchill is one of the few places where polar bears can be observed in their natural habitat, making it a popular destination for wildlife enthusiasts and tourists. The region is renowned for its polar bear tours conducted during the fall season, usually specifically designed tundra vehicles. Churchill is a focal point for polar bear research and conservation efforts, focusing on the behavior, population dynamics, and environmental responses. So basically, just the polar bears in their natural habitat without being messed with, and they're just known to be there, and they're not approached by anybody. They're just observed from a distance.